And talking health, World Lupus Day is celebrated every 10th of May, a global campaign aimed at raising awareness for millions of people affected by the autoimmune disease. It's a day to shine a light on their daily battles, correct the myths and fight the stigma often associated with the illness. We have details in this report.
Lupus is a chronic autoimmune disease that happens when the body immune system turns against its own tissues and organs. Despite the global impact of lupus, awareness about this disease remains alarmingly low, and according to the World Lupus Federation, over 5 million people worldwide live with some form of lupus, and about 90% of them are women. This awareness event serves as more than just a gathering. It is a platform where individuals living with lupus share their personal stories and inspire others with their strength and resilience.
Is that there is no center to screen for lupus in Nigeria. You have to take our samples out of the country, and this is quite expensive, very expensive. So we are calling on the government, we're calling on everyone to please put an eye on lupus, make lupus visible. I've been sick from childhood, but nobody knew it was lupus.
Beyond the fatigue and joint pain commonly associated with lupus, many patients also live with a signature butterfly-shaped rash across the cheeks and nose, skin irritations, and in some cases, organ inflammation. Sadly, children are not exempt from this complex disease.
To be honest, those children, they even need therapy than the adults. Some of them will come, they will tell you, do not take blood samples from me today. I am tired. I'm actually tired of blood samples being taken from me. I'm tired of taking these medications.
Though lupus is unpredictable, medical experts say it can be managed with early diagnosis, medication, and ongoing care.
They have to take their drugs in addition to the lifestyle changes. Eating healthy, avoiding fatty food, for instance, exercising, learning to manage both physical and emotional stress. All these are very important because these are things that can flare up the lupus.
Through shared stories and support networks, those affected by lupus are building hope, not just for survival, but for a future where they can live with dignity, free from discrimination.
Now, for more on the World Lupus Day, I'm joined by the founder of Love for Health organization, Dr. Yusuf Haroun. Good afternoon.
Good afternoon. It's a pleasure to meet you.
There seems to be some misunderstandings about this disease in spite of its global impact. Now, talk to us quickly about what lupus is and what are the symptoms.
So lupus is also called, there's one called systemic lupus erythematosus, SLE. And it's a condition which I saw first as a medical student almost 15 years ago. And it is a condition or a medical disease or disorder in which the body is fighting itself, and you don't know what is exactly causing this. You don't know what is exactly causing it. And there are classical symptoms or signs that you see in people with lupus. Number one, you see their face are swollen, like the ones on the screen. Now you see they have swelling face, puffy face, like a moon face. They develop renal conditions. They can even develop renal failure. In severe cases, they may even have dialysis. They have leg swelling or pedal edema, which we call. They have this butterfly rash on their face. It's like a butterfly. You see erythematous rashes all over their faces. So you see on their arms also, they have rashes on their arm, on their extremities. And it is called, you have on both sides, so it is bilateral rashes on the body. So these are part of the symptoms and signs. It can also be systemic. They usually develop high blood pressure, hypertension. They could also develop diabetes. So these are part of the clinical conditions in which you see in people with lupus.
Now, one of the challenges of living with lupus, as we have heard, one of the challenges of lupus, persons living with lupus, as we have heard, is the difficulty in diagnosis. We have also heard that it's not curable. How accessible and affordable, is its treatments? And when we talk about management, to control its symptoms and to also prevent complications.
In our economy, it is very, very expensive. Even in the Western world, it is quite expensive, especially where there is no government intervention. So I'll give a classical experience which I faced. I was opportune to manage a lupus patient because I was in rheumatology unit. And in the rheumatology unit where I was, this patient had to be on steroids daily. And the steroids at that time was about 15 or 20,000 naira. Imagine now, it's going to be hundreds of thousands, taking that amount daily. In 10 days, someone is spending ₦1 million. How many people can afford this? Economically, it is suicidal for them, especially if somebody cannot afford it. Unfortunately, again, most of the patients I witnessed who had this case of lupus, unfortunately, didn't survive. Unfortunately, they did not survive. They passed away. So it is worse even when it happens to a child. I've seen children with lupus, even children who are less than 10 years old, they are developing lupus. They have this butterfly rash on their face. They have rashes on their arms and legs. They develop kidney failure. They have diabetes, leg swelling. And their parents have to keep spending thousands of naira daily. In a week, they've already spent over ₦1 million, including hospital bed space, including medications. Most of these steroidal injections, there are even specific steroids that these patients with lupus take. It's very expensive. Then medical bills, drugs, hospital admission, and all other miscellaneous. It is very, very expensive for them, apart from the stigma they even face in the society. So many of them usually pass away. I believe the government can do a lot. And the Lupus Association, which was founded even about 2004 in the US, and it's also here in Nigeria, it's creating more awareness. The case is getting alarming, and the number of people with this condition is increasing. The main cause of this autoimmune disorder is idiopathic. That means we don't know the actual cause of this disease, but we know that there are some certain risk factors of family history of people with lupus or with associated autoimmune disorders. So this is a condition which we need to do more research, especially here in Nigeria. Some of these diseases were termed white man's disease, but now we are seeing that they are even happening to we blacks in Africa and in Nigeria in particular. So when the research was done about lupus, it was found that some particular regions in Nigeria were susceptible or developed this lupus more than other regions. It's also found out that a particular
I may have to interject there. While it is important to grow research or do more on research, are there support networks or some sort of a support group for persons living with lupus, to help them live free from discrimination, at least in Nigeria? Quickly.
In Lagos State University College of Medicine and Teaching Hospital, where I graduated from, there is this association, especially in the pediatrics, because it happens to children. So there is a lupus association there also in Ikeja and also in Nigeria, which supports these people. But the major challenge they are facing is underfunding or poor funding. So I'm using this opportunity to appeal to non-governmental organizations, to governments, and also to other bodies who are willing to support them to provide more funding and finances. May 10 is World Lupus Day, and we should always use this opportunity to care for people. And this is an opportunity also which we in Law for Health are trying to do, provide love for people. It's a serious case, happens to elderly, happens to children, happens to many people. The cure is unknown, and the cause is even unknown. We just have certain risk factors that could predispose to it, but we don't really actually know the main cause of this lupus. And the cure also is idiopathic. We don't know. So associations are there, but they are underfunded.
We may have to